Good morning. I'm so happy to be here and actually present the second report of the progress for the defeat GBM. I think we were here last year. It's been 18 months since the initiation of defeat GBM as the MBTS initiative. So I'm going to Carrie asked me to give a little overview before we introduce the PIs that have been working fiercely and very hard to make things happen. So this is not my slide. This is my slide here, okay? So you may ask why we organize defeat GBM. Well, we're dealing with a very difficult, very complex disease. GBM is probably the most heterogeneous and most resistant solid tumor that we deal with. As I mentioned last night, the prognosis of patients with a GBM is still very bad. Even though we have made progress, but it's still dismal. Median survival is only 14 months, and only 8 to 10% survive for 5 years. And yes, we have some good therapy with radiation therapy and Timidol and CCNU. It's just not enough. We still lose 90% of patients within 5 years. And so that's why we think that by developing a very focused, task-oriented, patient-oriented program, defeat GBM, that we can move the needle faster. And we want to move from understanding the disease, in the molecular level, finding target, finding why the tumor is so resistant, taking it into the next level in translational to the clinic by finding drugs that go to the brain and testing it in animal model before we go to the patient. And then we can deal with some of the challenges in the clinic, such as developing smart clinical trial, working with pharmaceutical company, which usually do not pay much attention to GBM, to the brain, because from the pharmaceutical point of view, developing a drug for systemic cancer, they don't want the drug to go to the brain cause any kind of side effect in the CNS. So our task under GBM is to really getting a drug to the target and also go to the brain. And that's the model of the defeat GBM, is we start from the ground, we find the right target that is meaningful and specific for brain tumor and GBM, and then develop the right drug, and then also using biomarker approach to identify the right patient for the right drug. And for that, we developed this jigsaw puzzle of 4 elements and 4 core. The first core is trying to study the biology, identify the right target, and then we move on to the preclinical model and drug development pipeline, identifying the right drug. We can work with biotech company, pharmaceutical company, or we work among ourselves and really develop a drug. And then we can, with the connecting the discovery to the clinic environment, looking at the patient material, we develop biomarker panel that we can identify the patient that have the right target so that we can deliver the drug to the specific group of patients. And the fourth side is the clinical trial model that we can go in a continuum from the laboratory to the clinic, taking what we learn from the laboratory to the clinic, learning the problem in the clinic, going back to the laboratory, so we can go back and forth. That's what we want to do with defeat GBM. Defeat GBM was kind of the brainchild of a group of scientific advisors. And this is the group of scientific advisors. Besides myself, we have people like Webb Cavany from the Ludwig, and from the pharmaceutical company, Richard Gaylor, Ann Barker, who's the ex-deputy NCI director, and was instrumental in developing the TGCA project, giving us a lot of target and GBM. And then Rich Berger, Daryl Bicknell, Dimitris, and Bill Hahn formed the group of scientific advisors. Now, in a short 18 months of the since initiation, I must emphasize, we have made a lot of progress. GBM, we actually had identified targets already, such as BIM1, it's come off the work of Frank and Webb. We're working fiercely on how to really bring the discovery of BIM1 as a resistant protein that convert resistant tumor to EGF receptor inhibition. That's how we're going to find a drug, develop it, and go to the clinic. With our screening, our drug development core, we've been working on identify several targets. One of the ones that is going to the in vitro, from in vitro to in vivo, is a PARP inhibitor, the BMM 673. There's several other targets that we will, hopefully in another year, we will be able to bring you progress. And then finally, Paul Michel's and Tim's work really focus on not only linking pathway in terms of growth, but we also linking signal pathway to metabolism. So here's this is the list of publications. It's in pretty tall order in 18 months, I must say. Defeat GBM not only has demonstrated itself that we're heading the right direction, we're making really stride forward. And we still have a lot of work to do. And so hopefully you will be able to hear some of the progress that we made in the last year. And then we'll be able to tell you, the investigator will tell you what we have done and where we're going.